work with European network, with Ergo Network, which is European Roma organizations in countries of the European Union, but also in candidate and enlargement countries. We focus our work in fighting anti-Gypsyism and protecting Roma across Europe. My expertise within the organization is to provide policy advice to the European institutions when it comes to Roma issues, anti-discrimination, anti-Gypsyism in particular, but also environmental justice, intersectional discrimination, empowerment of Roma, and participation.
Thank you so much. And we can proceed with our last but not least presenter, Mr. Milan Zverepa. Are you here with us?
Yes. Hello. My name is Milan Zverepa. I'm Director of Inclusion Europe. Inclusion Europe represents people with intellectual disabilities and their families. We have members in 49 European countries. And we, of course, work a lot on subjects related to the topic of the discussion today, such as discrimination in healthcare, also segregation in care institution, lack of education, and other topics.
Perfect. Thank you all so much. So our webinar will have two parts. The first and main part is a panel discussion. We're going to address 6 questions to all of our guest speakers one by one, and we are going to share their ideas, point of views, and their knowledge. And then our final part will be more interactive, and you will be able to share your questions and address some points that you would like and concerns. So don't hesitate to press the raise hand button you have or write a message on the chat below. So thank you all so much for being here. And I think that we can proceed with the first question, which is, what do you think discrimination is and why is it such a crucial issue in Europe? So we're going to have a rotation, starting by Mr. Divek Kumar, then with Mrs. Michalaki, and then with Mr. Zverepa.
Okay, thank you. So what is discrimination? Discrimination is the unfavorable treatment of a person or a group based on a particular identity or characteristic that they possess. So it could be anything, it could be based on someone's gender, their abilities, but generally in this context, we talk about racism and xenophobia, so particular forms of prejudice directed towards someone's race or ethnicity or migratory status. But discrimination per se could be on any factor that someone possesses. Why is it important to Europe? I was reading a quote by the head of the United Nations today, Antonio Guterres, who said the coronavirus pandemic has unleashed a tsunami of hate and xenophobia, scapegoating and scaremongering. So this is happening within Europe, but across the world. I mean, this is a worldwide trend where we are seeing increasing numbers of populist leaders, populist movements that target a particular group. And that's happening, for example, in Italy under Matteo Salvini, in Hungary. In the UK, where I come from, we have the hostile environment towards migrants. And a lot of our debates around Brexit and leaving the European Union was centered around anti-migrant discussion. So at the moment, it seems as though other groups, migrants, for example, are being targeted. Matteo Salvini, for example, described African migrants bringing COVID-19 to Italy when it really had nothing to do with those people. And if anything, migrants are more likely to get the illness rather than transmit it onto others. So I think this is an incredibly important time to be talking about discrimination, about actions towards others. And an epidemic like this just heightens all these tendencies. Thank you.
Shall I just continue?
Yeah, yes.
Okay, because I was waiting for it. Totally. I mean, what can I add to what the previous speaker has said? Maybe just to say that discrimination is unlawful, right? So no matter the conditions, no matter the situation, and we have seen that during the pandemic, governments across the world have taken measures to restrict certain civil liberties and certain rights, which can be justified, but they only have to be for a temporary period, and they have to be legitimate and proportionate to the objective, right? So it would be objective and legitimate to restrict the right to movement, for instance, right? It would not be legitimate to, for instance, start to discriminate people because of their protected characteristics, as my ante-speaker has said. So this is important to note that discrimination, it cannot be justified nor negotiated under any particular crisis, and human rights should not be negotiated as well. And it's important to also say that equality and freedom for discrimination are really the fundaments of any democratic society. You have asked as a second part of your question why it is important in Europe in particularly. Well, I think that after the World War II, Europe was really keen to avoid human rights violation from occurring again. And therefore, we have adopted in 1915 the European Convention for Human Rights, which is really the most inspired, obviously, by the UN Declaration for Human Rights, which is the most progressive standard that we have in Europe, which is basically to protect the rule of law, democracy, and human rights. Within the European Union as well, we have made a lot of headways. And with the Amsterdam Treaty, we have a lot of tools to protect people from discrimination on any of the grounds that have been mentioned, whether it is gender, whether it is nationality, whether it's sexuality, whether it's race or ethnicity. We must be protected against discrimination. So yeah, that's more or less. There's maybe to just add that there is different types of discrimination that we can mention. Discrimination may occur in different situations. There is the so-called direct discrimination, indirect discrimination, discrimination by association, discrimination by perception, even harassment can be under this category, and assault, victimization, even order to discriminate, and so on and so forth. Just to give you a couple of examples, maybe for the direct discrimination, let's say. For instance, you have a particular qualifications, you apply for a job, and you have been refused because you have a particular characteristic that is, let's say, visible, notable. You are older, or you are younger, or because you have a veil, because you are a Muslim woman, and so on. Or indirect discrimination, again, and this happens a lot with Roma across Europe. It can be supposedly neutral policy either of the state or of a company that basically says, let's take, for example, your company has this policy that you have to work on a Saturday, right? Although this is neutral and you say, okay, we can do that, it actually may discriminate if you have within your company Jewish people against them because they cannot then observe Shabbat, okay? So discrimination can occur in different instances, but it's important to know your rights. It's important to claim your rights, and there is a lot of legislation to protect us against discrimination. Unfortunately, we also know that legislation is not always enough to protect us from discrimination, that we have to have a strong judicial system in order for us as victims of discrimination to be able to seek for redress and protection.
Thank you so much. And Mr. Swerepa?
Well, I guess to add to what was said before, just to stress that discrimination is not just some abstract concept. It's a matter of life and death in many instances, and it's made very clear by this coronavirus emergency. We have discrimination is being treated differently than you would be if you don't have disability, if you weren't women, if you weren't of a different ethnic background. And we can see instances of this happening very often. There are people with disabilities infected by the coronavirus, but released without treatment and released to institutions, residential institutions with others, where they infect them as well. There are people with disabilities who are not treated in hospital because somebody in the hospital decided they scream too much. Or there are people with disabilities being assigned do not resuscitate labels just because they have a disability without anyone asking them or talking to them in any way about this issue. So discrimination is, of course, a very serious concern and affects people, and it's very obvious how it affects them, not specifically during, let's say, this healthcare crisis that we are currently undergoing.
Thank you so much. So talking for the current affairs and the pandemic that we're all going through, why do you think coronavirus pandemic was such a huge trigger for discrimination to be conducted and sometimes even justified on social media and out on the streets? Which societies are affected the most? We can start now with Mrs. Michalake and then continue with Mrs. Zorepa and then with Mr. De Weekmar having a rotation.
I think that the lack of knowledge and limited information about this new virus, the misinformation and really the sudden change of our life patterns, particularly the confinement, the social distancing, it just creates more fear in people for the unknown and the potential of getting sick and maybe even dying, which obviously increases the level of anxiety, we can say even exponentially, which triggers protection mechanisms, irrational reactions, including discriminatory behavior, racist behavior against particular or specific groups of people, those that are in first line, that are the health professionals, for instance, or those we don't really know, which are easy in any case we don't really like on a daily basis so much, or those that sometimes the state authorities or media try to scapegoat and speak against. And as we really rely and trust the state and the media, we take for granted what is given to us as society. And unfortunately, what we have seen during these 2 months and more is that media really looks for sensational news and do not really check or take the time to verify the resources and the adequacy of information. Unfortunately, just discrimination and a rhetoric that is it's racist. In the case of Roma, for instance, you can see examples of by political discourse and by media rhetoric against Roma, and this is unacceptable, unfortunately. So media has an important role and is able to give the society the answers that they seek, and it's sometimes is being taken as a momentum to really use this opportunity even for for politicians to go against those that are more
Thank you so much. We are probably having some technical issues, but I think that we all can hear you clearly. So we can proceed with Mr. Sverepa.
Yeah, on the question of which societies are most affected, I think that discrimination obviously is not a competition, and it's the effects are felt by those individuals experiencing, and they will be very severe for each of them. At the same, what we can also see, obviously, just following the news, that one of the, let's say, a group of people most affected, let's say, by this whole situation are the old people, people living in nursing homes and residential institutions, and that extends also to people with disabilities who live in those institutions as well. What I believe is important to realize that there is nothing new about discrimination that we can see now during the coronavirus crisis. That has always been here. People with disabilities have always experienced these kinds of forms of discrimination. What the corona crisis does is make them more pronounced, make them more urgent, and let's say makes them visible at a larger scale. But people with disabilities have been denied proper health care before coronavirus. They have been segregated into so-called care institutions before coronavirus, as they have been denied access to education before coronavirus. So it's important during conversation about discrimination at this time to remember that this is not this kind of discrimination is not going to go away when the coronavirus goes away.
Thank you so much. And Mr. De Weekmoor?
Thank you. In many ways, I don't have very much to add. I think it's been said. In times of stress and fear, it's very easy to target another group, and that other group could be any marginalized group. Talked about Roma people, people with disabilities, for example. And leaders use this. They use these facts to scapegoat others, to cover up shortcomings, and that could be immediately within the crisis, but it could also be some of the many underlying factors that lead to increased vulnerabilities of people. So within the UK, the chronic underfunding of the NHS and of public health services, of health protection services and preparedness leads us to a position where the crisis is much worse than it could have otherwise been. So in terms of who is affected most, again, it could be any marginalized group. Analysis that colleagues of mine and myself have done recently have been looking at ethnic minority mortality in the UK, and we found about a 2 to 3 times increased risk of death in Black and Asian groups compared to the white population in the UK, in England, I should say. So we see these differences in mortality due to COVID-19. And particularly amongst migrant groups, we see issues around access to the health service. The UK has introduced charging for the NHS, an otherwise free-to-use service. So for any migrants, they have to pay for certain services. COVID-19 treatment is free, but this barrier, it's very confusing. People don't know when they can access services, which leads to presenting late, having a more severe form of illness, and increases your chance of severe illness and mortality. And these factors do discriminate. They discriminate quite overtly against certain groups. We have this hostile environment in the UK that's meant to prevent foreigners coming to the UK. And I think all these factors are heightened within pandemic or an epidemic, a time when there's increased stress on all resources in the country. Thank you.
Thank you so much. I think we have one more additional points from Mrs. Michalaki.
The second part of the question, can you hear me?
Yes, you can hear you.
Okay. I just missed the second part of the question, and definitely I think it's also important to say that all societies that are in poverty and cannot observe the hygienic and sanitary norms, or do not have a very strong or inadequate or have an inadequate health systems are and can be affected by this. It has been already mentioned, the migrant people, but also the asylum seekers and the refugees that are living in camps. If we look at the example of Greece, but also Italy, we can see that the situation is really very dire, very serious. In the camp of Moria, for instance, let's say 1,400 people are kept all together without the possibility to go out. So if someone gets sick, then there is a danger that everybody gets sick. But then there is also people that are in detention, so in prison, in jail, in immigration detention centers. They really have a difficulty of time right now, and there's even measures of them not being able to get visits, but also medical care sometimes is restricted, or access to a lawyer. So even certain rights are being restricted in some of the countries, which is an extra burden, or if you want, we can look at it as discrimination. Then there are also the homeless people that we didn't mention, which are also very much affected because they don't have where to confine and where to observe all these protocols of hygiene. Women and girls are particularly vulnerable and affected by the virus. Worldwide, there are reports that talk about domestic violence against women in this time of pandemic, and the lack of access or the lack of possibility to really ask for help or to be put in safe shelters. So that's a big problem. It's also a problem for them to now access, if you want, their reproductive rights. For instance, with the medical supply shortages, it's very difficult nowadays to get contraception, and it's going to get even harder. So that's a problem. Those in the informal work, in the informal economy, they're very much affected. Those that are working in agriculture, those that are working as in the street markets, those that are seasonal workers, these are all very much affected by the pandemic in terms of their economy. They don't have their income, and the state has to intervene to protect this. There is also the LGBTI community that is very much affected. And as has been said, the racialized minorities. Let's not forget also the frontliners, the health and social workers, the doctors, and those in the food supply chain that are also affected, and they are stigmatized. While on the one hand, you see that at 8 o'clock here in Belgium, Brussels, we go out to applaud for the healthcare workers. We also see that it's very hard for all these frontliners to basically reside nowadays in Belgium, because they can infect their neighbors. So the stigmatization is really strong, and they're quite affected, and they need to be protected. So there are a lot of categories nowadays, and unfortunately, this is increasing even more. And we didn't mention that probably the first ones that have been affected were the people of
Actually, we're still having some technical issues, but I think that we have understood your point. Thank you all so much. You have raised so crucial concerns to all of us. So we can proceed to the third question, which is, we had pandemics before in the 21st century. On what aspect do you think COVID-19 turned out to be different in terms of it coming out at such times that social media and online communications were booming? And how discriminatory events and incidents were impacted by social media praise. And we can have Mr. Zverepat first, and then Mr. De Wigmar, and at the end, Ms. Michalaki.
Right, not being social media expert, it's kind of hard to answer this question in particular. But I would say let's not to start with the positive aspects of the means of communication that we have at our disposal now, which would include social media, and that is being able to follow an exchange on the developments in different countries and different regions, so we can keep quite a close, being closely informed about what's happening all over Europe. In our case, and that's very much thanks to social media. So it also allows us to raise more awareness of what's happening and then share all the kinds of discrimination, or also the positive actions that we see happening during this situation. And of course, on the negative side, as usual, there are some people who use social media to bully others, and that we can see, of course, happening to people with disabilities during this situation as well. I say especially in countries which had the strict lockdown rules like Spain or France, where people with disabilities who had the permission to go outside so they can exercise were subjected to abuse by the public because they were perceived to be in violation of the rules of the lockdown. But maybe personally, the hardest thing and typical for this social media age was to kind of monitoring the situation and what's going on, what's happening in all kind of context, be it the denial of healthcare I talked about before, or people not being treated in residential institutions, or the families being left out with any kind of support during this whole time. And on social media, just constantly following people complaining that they are supposed to stay at home for a couple of weeks and watch Netflix. So that was another aspect of the social media age I kind of noticed.
Thank you so much. Mr. De Wigmar?
Okay, so why is COVID-19 different to previous pandemics? If you look at the virus, it is a novel coronavirus that can affect the whole population, and no one has immunity to it, and there's no treatment or vaccine for it. So it's something that can spread quite easily. It has a high reproductive number, so it can pass to estimated 3 others. And it's also a respiratory virus, which is very difficult to control. So there's numbers of factors around the virus itself that gives it a pandemic susceptibility. And compared to other outbreaks, SARS, for example, similar type of virus, had higher mortality, but it had a lower reproductive number. And very importantly, with COVID-19, there's this asymptomatic period. So you can be infected before you know that you have the illness, so before you're showing any symptoms, which makes it much harder to control. Other outbreaks, Ebola, for example, had much higher fatality, but it's more difficult to transmit the infection. So there are specific things about COVID-19 that make it something that could go into a global pandemic. But then that's coupled with modern society. So the hugely connected world that we live in, physically and virtually connected. So the virus can easily move from person to person, and people travel, tourists, holiday makers, business travel, huge number of flights that go around the world. And we see this transmission following routes of really business routes from China to London, for example, and New York being one of the most highly affected places. But it is slowly spreading around the rest of the world. So increasing numbers across Asia, across South Asia, across Africa, South America. These numbers are increasing now, following North America and Europe, and of course China and Eastern Asia before that. In terms of social media, I think it's so easy for people to communicate, and that's a good thing in many respects. It's much easier to transmit positive information, but it's also easier to transmit negative information, discrimination, and we see the ideas of echo chambers where you speak and you know people who think similar to yourself, and particularly in the more closed groups, the ones where false information can spread very easily. Another aspect I think we need to think about and just be careful in the future is surveillance. So certain countries are introducing surveillance techniques to monitor the infection, and it can be very useful in that respect to look at the spread of the infection. But we have to be careful once this is over in years' time. We have to scale back those forms of surveillance, and those types of surveillance tend to affect marginalized groups the most. Classically, young ethnic minority groups, migrant groups tend to be the ones who are most targeted through these surveillance techniques. So we have to be careful about what happens in this period and how that progresses after. Thank you.
Thank you so much. You have shared so important data with all of us. And we can conclude this question with Ms. Michalaki.
Yes, thank you very much. I don't know, I'm trying without a camera to see if the connection is better. I don't have much to add. Actually, I don't have anything else to add, having in mind that I'm also not a medical professional, and everything has been said, from including the traveling opportunities and also the access to information and social media, which makes this a bit different than anything else that we have experienced with SARS, Spanish flu, HIV, and so on and so forth. So the only thing that I think we need to be very careful is really to make sure that we get accurate sources of information, and we have to check relevant published scientific journals and whatever information we can get from World Health Organization.
Thank you so much. So our fourth question is, so what do we as the future healthcare professionals need to do? What are some of the ways we can fight against discrimination in personal and social ways? And now we are going to start again the rotation, and we're having first Mr. Devey Kumar, and then Mrs. Michalaki, and at the end, Mr. Zverev.
Okay, so what can health professionals do, future health professionals such as all of you? I broadly split that into two kinds of roles. There will be your clinical role, taking care of patients as doctors in primary care and secondary care, but then also a public health role. So within clinical role, I think that the vast majority of healthcare professionals try to treat their patients as well as they can, and I don't think people discriminate on purpose. But I guess we need to think about some of the discrimination practices that lead to people becoming unwell. And we also need to think about our unconscious biases. So there are many factors that we don't know about. We might treat people differently according to any number of characteristics, and we're not fully aware of that. And it's useful to think about those things, and constantly question yourself, am I doing the right thing? Am I making sure that I'm treating every person fairly? Not necessarily equally, because people have different needs, but is every patient I see being treated fairly? getting the best treatment that they can. There are specific things that can be done for certain groups, improving language communication, making it culturally appropriate, some forms of outreach, so patients in primary care, focusing on certain populations at risk, so in nursing homes and in older people's homes. So there are specific kinds of things that can be done. But I think I don't think most forms of discrimination are on purpose, but I guess being aware of this is useful. But then my second point is really to think about public health aspects. So I guess my plea for most of you, and you will mostly become clinicians, but if you try to take on a public health role in addition to your clinical work, and that's to think about issues such as healthcare access. Who is it that you're not seeing? Why are you not seeing those people? Just think about the determinants of health. Why do certain groups have much higher mortality rates? Who is missing? What are the environmental factors? Air pollution, kinds of nutrition, all these socioeconomic factors that were mentioned by my colleagues as well. We call zero hours contracts, the insecure forms of work that lead people into more risky jobs. And discrimination. Most clinicians don't think about discrimination as a factor that affects your health. So I think we need to factor in all these points, and health professionals have a powerful role as advocates for their patients, as advocates for the population, doing research, reaching out and connecting with other organizations that work in these fields, non-governmental organizations, grassroots organizations, the government as well, the different departments within governments. So I think health professionals have a huge role that is outside of your standard clinical role, and I guess I would urge all of you to try and take that on to some extent. Thank you.
Thank you so much. Mrs. Michalaki?
Yes, I mean, what I would just add to this is to really observe the right to of everybody to be free from discrimination in their access to healthcare. And I would also give some, unfortunately, negative examples, again, in the case of Roma, in the former Czechoslovakia, when we would see that health practitioners would actually be engaged in discriminatory practices against Roma women by forcibly sterilizing them when delivering babies through cesarean section. So it's very important that health practitioners themselves do not hold biases, and they act on their biases, and they treat everyone in a non-discriminatory way. I think it's also important to note that the pandemic that we are living has already disrupted daily routines, the way we have been living. So people are already anxious, panic, and they feel isolated, and they act from fear. So it is an important role for health practitioners to be able to provide that that care, that's mental support to the patients, which is crucial in this period. It's also, I think, important to learn from previous pandemics that we have, particularly from the earliest one, which is the HIV AIDS pandemic, when those infected were rejected by their families and their friends when they were testing positive, and they were being harassed, assaulted. So again, the role of the practitioners is really important to make sure that they don't shy away when there is discrimination that is taking place in healthcare facilities, that they speak out against discrimination, and that they protect their own patients. It's also important to know that many medical professions have their own platforms, and they are very trusted professions. And in many of the occasions, they have been seen, and they are being seen as heroes nowadays. So I think that they can use these platforms that they have to speak out against racism and discrimination that is happening outside or inside the institution. They can use videos, they can do campaigns as well. They can also stay informed, and they can also share and educate their patients about what coronavirus is and what are the consequences, and they can also avoid to spread misinformation. Yeah, and someone has said before that it's also important for health professionals to adapt the information and their behavior to those that need it in the way they need it. The ones that are less educated or the ones that really fear to be hospitalized. So we should not use the same approach with everybody. We should be able to adapt our approach according to the needs.
Thank you so much. And Mr. Zverepa?
I guess to add to all that was already said, and in regards to providing medical care to people with disabilities, it's important, and it's still an issue that needs to be addressed is for the medical professionals to approach people with disabilities as people, to see the person, not to see the disability first. Also, not to see disability as a medical problem, as a health issue. It's not a disease. It's important to treat people with disabilities the way they would treat anyone else, both in a medical sense, so providing adequate health care as they would to anyone else if they didn't have disability, and in the sense of the relation between the professional and the patient, and so how they would normally relate to a person, how they would talk to them, how would explain things, how they would ask for permission to carry out procedures. So that would be essential to start combating discrimination. People with intellectual disabilities frequently are experiencing that professionals talk to someone else, not to them, talk about them, not to them, do not consult with them. If they have somebody who accompanies them to a hospital or whatever, they will talk to that person about the actual patient there. So that is an important element to start dealing with the discrimination here, to treat the person and not to focus on the disability.
Thank you so much. So our fifth question is, as you know, so many of our participants are here as members of EMSA, European Medical Students Association, to represent medical students, and some of them are involved in other kinds of NGO work. What do you think about the role of youth involvement and the impact of youth projects to fight discrimination? And now we're going to have Mrs. Michalake first, and then Mr. Zverepa, and at the end, Mr. Divekkumar.
Yes, I think it's absolutely crucial to have young people involved in fighting discrimination during this pandemic. I mean, not to forget also that in terms of health-wise, youth have a stronger immunity and therefore less likely to have severe symptoms of the COVID. Therefore, there are also, from this perspective, I think it's an added value to have youth involved, even with supporting those that are vulnerable. When it comes to fighting discrimination, I think that young people can use the online media and platforms, the digital media, to share correct information about the virus, particularly for medical students, and dispel common myths about groups that are being discriminated against. I'm sure you all know about the campaign by the Chinese students, "I'm not a virus." So that example of a campaign, I think, is very positive. It's something that can be replicated according to different other contexts. So engaging in digital advocacy and campaigns is something that would be very, very useful. And something that I can do use is very much into all digitalized. So maybe contacting internet software companies that can provide tools for distant learning for the most vulnerable children and communities is also something that can be done. Report, just to give you the example of Spain, and I think I've seen someone from Spain among the participants. We have received yesterday a survey about Roma communities there, with a survey of 11,000 people, and it was said that 40% of Roma children cannot access this internet. They don't have internet, they don't possess a computer or a tablet to be able to do their online distance learning. So I think that it's important for all of us to be able to contribute so that they get these utilities, the internet connection and the computers from some donations, or maybe having some contracts with different companies. To the extent youth is engaged with this, we would really benefit a lot from, as a society, from them contributing to it. And I'm sure there are more, but I'm sure the colleagues can contribute more to this question.
Thank you so much. Mr. Zverepa?
Yeah, there can be so many things, obviously. To make it short, I just say it's important to always try to lead by example and show others what can be possible, and just to be very practical, maybe share the information and examples that are being discussed here with others in your social networks, both virtual and real. Being volunteering for good causes, of course, an important contribution, both to the people who receive that support, to the organizations that somebody is volunteering for. It's also an important contribution to the volunteers' personal and professional development, learning new skills and gaining new experiences. What in our line of work, I would also advise caution for the causes that people volunteer to help with, because a lot of the volunteering work actually contributes to perpetuation of segregation, be that volunteering in segregated so-called care institutions or in other settings. So just to add another aspect to it, it's very, very important to select carefully what kind of cause one supports by volunteering, and if that cause actually helps people to live lives fully integrated, fully included in society.
Thank you so much. Mr. David Moore?
Yes, so youth involvement in these movements, it's crucial. If we look at climate change, for example, it's led by adolescents and younger people. And we need younger people to really push for change, to make your voices heard, and think about not just this outbreak, but the next one. Because we've had SARS and we've had MERS and we've had Ebola, and we constantly have measles outbreaks. And this is not unusual to have outbreaks of infectious diseases. This one is much bigger, of course. But in some ways, it could be much worse, and the next outbreak could be much worse. A higher reproductive number, a higher mortality, case fatality rate. So I guess learn what you can from this outbreak and think about the next one and ways to prepare and to treat people as equitably as possible, in not just now, but in the future as well. In my own example, I have a project going to schools currently in London, but hopefully in the UK, talking about issues around migration and xenophobia, discrimination, particularly around healthcare and health access. And these kinds of programs take you to a population you don't normally speak to. So in my case, with children. But as much as you can, work with organizations doing this kind of work, do the kind of outreach work where you can discuss these issues, talk about issues of discrimination, about some of the unfair practices that happen. Thank you.
Thank you so much. So we're having our last but not least question of this main part of the panel discussion, which is discrimination is especially dangerous when it happens in the hospitals. It can be a matter of life and death for the patient. Having all the ideas said before, we'd like to sum up, telling to our participants, what do you think about the role of physicians in this vicious cycle of hate and fear, especially considering the events that happened and we have to learn from during this pandemic? And now we're going to have Mr. Zverepa first, then Mr. Devekmar, and finishing with Mrs. Michalaki.
I think most of it has already, I believe, been discussed during this session. So maybe just to wrap up a little bit and add one more element, but briefly. I think obviously one big part of it is just to provide proper care to those affected by discrimination. So to provide proper care to make sure that discrimination doesn't happen, and to maybe make the extra step, knowing that there are certain people who are more likely to experience discrimination. So maybe taking some extra steps to make sure that the healthcare actually reaches those groups of people. What I would like to add, maybe once this is over, and hopefully, of course, sooner rather than later, I think it would be very important for the medical professionals and to involve representatives of the people we were discussing here in evaluating of all the procedures, of the experience in designing new policies and new procedures that will inevitably be drafted to deal with possible future situations like this. There was already mentioned as well, there's a lot of lessons that can be learned. There's a lot of unnecessary problems that were created that can be avoided with a proper communication. So I would urge everyone who will be in that position to involve people with disabilities and all the other people who are affected by discrimination in making the evaluation of what was going on, what worked, what didn't work, how discrimination was perpetuated, and designing the new procedures.
Thank you so much. Mr. Devekmar?
Yes, I don't think I have a huge amount to add from what my colleagues and I said before. I think the vast majority of professionals are doing their best.
Sence teknik bir sıkıntı var mı? Nasıl?
Oh. So I think the vast majority of health professionals are doing the best job they can in very difficult circumstances, where they may be putting themselves at harm as well. But a few factors is just to think about the forms of unconscious bias that each person has, and to think about some of the inequalities that are bringing people into hospital and some of the extra needs that people might have. So I mentioned increased mortality amongst certain ethnic groups, and the colleague just mentioned people with disabilities, Roma people or others having particular needs as well. So if there are adaptations you can make, language, a colleague of mine told me about how somebody presented very late and was kind not treated very well due to language issues where they couldn't speak to her properly. So there are things like that that certainly could be improved immediately. But I think, as my colleagues said, we need to think about this outbreak and learning lessons and including populations who are regularly discriminated against in many different aspects of healthcare, and including their voices in how we design the health service for the future.
Thank you so much. And Ms. Michalaki?
Yes, I don't have much to add either because more has been said and refined now. Maybe just to say that obviously we have seen that the pandemic doesn't discriminate and it affects everyone. So I think that that's an important thing to remember, that we shouldn't discriminate neither, both because it is unlawful, but also because it's not practical, as this virus is highly contagious. So that unconscious bias that my colleague has talked about, we have to be aware of it and try not to make differences between patients when treating them. So yeah, I think the colleagues also mentioned further protocols based on lessons learned from the pandemic that we can draw from. I think it's also important now with some of the measures to track down the virus and all the contacts. It's important for health professionals to ensure the patient confidentiality and the data protection of their patients, no matter what the government might ask them to provide them with. And really to speak out and report cases of malpractice or discrimination by their colleagues. And I cannot maybe emphasize enough, because that's really a huge reoccurrence in the case of Roma these days. Many times they refuse to let their children go to hospital because they are afraid of what it can happen to them, although infected. So in cases like this, we really need doctors to be sensitive and to adapt to this situation and try to provide additional information in a language that is accessible, understandable by everyone that basically needs it. So that adaptability, I think, is crucial in saving lives. Yes, thank you.
Thank you all so much. So we have concluded our first and main part of panel discussion, and now it's the time for some interaction with our participants. So you are more than free and welcome to press the raise hand button, and we will choose randomly 3 or 4 questions for our guest speakers. Or you can write a message on the chat section with the question that you would like to address. So now I'm taking the participants list. So I can see a question here. Do you believe that the pandemic is going to have an outcome on immigration or other policies internationally? Whoever feels comfortable to answer this question is more than free.
Can you say again, will the pandemic have an effect on immigration afterwards? Is that...
Yes, or other policies on an international level.
I mean, to a certain extent, it has had an effect on immigration, and countries have closed borders, and leaders of countries have pushed for their anti-immigration policies already. President Donald Trump said we have to build a wall between the USA and Mexico to stop coronavirus. However far-fetched these things might be, these the pandemic has already pushed anti-immigrant policies and rhetoric. Whether that will continue afterwards, I don't know. It could, so we could see doubling down of these kinds of policies, the classically populist policies targeting certain groups. Potentially, some of these leaders may lose office because of the way that they've handled the pandemic. So things could change the other way. It's very difficult to tell, but there certainly is a potential for much more stringent anti-immigrant policies following this.
Thank you so much. So once again, all of the participants are free to press the raise the hand button that they have in order to address a question or use the chat section. I can see a question here, just a minute. What is your opinion on how can students directly be involved in abolishing acting against discrimination? I think that we have answered somehow this question, but you could wrap up with some ideas of projects or other ideas on a local level that students can do.
I think I'm not, youth is not necessarily my profile, but there are a lot of EU projects that students can apply to. I think Erasmus and Erasmus Plus that focuses particularly on youth activities, and now with the new programming in funding the Erasmus Plus, there is a lot more flexibility, and I think even more money for ingenious and smart ideas that can be implemented. So then I would recommend just maybe checking on the website or getting in touch with the director that is dealing with Erasmus Plus to ask for more information.
Thank you so much. And I can see one more here about what individuals in general can do to tackle discrimination in their everyday life, especially if they are witnesses of such events in their everyday life.
I don't know if my colleagues want to say anything, but I can start. What they can do, obviously, is to report the case. They can report it to the police, or they can report it to the equality body in their country. Both is possible. It might be easier maybe to go to an equality body because they can also advise them how to do the complaint, or just go to the police. Nowadays, we see a lot of the cases of discrimination that are being addressed just as a result of people posting that information or recording it and posting it on the social media. And then authorities may act on their own to basically to check the information, like in the case of police abuse that happens. So just talking about it, just putting it out there in the media, reporting it, sharing it with someone, it really helps. And that's something at Reach that we can all do.
Thank you so much. Is anyone of our guest speakers willing to add something? Or would you like to proceed with the next question?
Maybe just very briefly, of course, it's very, very good to see that medical students are interested in discussing this subject. So thank you for organizing it. I think it's a very good first sign that you have so many participants. You're taking interest. To add what the suggestions were before, I think it's also valuable to just share publicly any kinds of experiences one witnesses or experiences personally, and to make people aware and help them understand what's happening and why it's wrong. And that's where we can go back to the social media can be helpful in doing that.
If I could add very briefly in terms of healthcare in particular, there are a number of organizations that work on issues for particular groups, some that work specifically on discrimination as well. There are student groups. My school project, for example, is going to involve student groups in my own university. So there are a number of different organizations and groups that people can be involved with to help tackle different kinds of discrimination.
Thank you so much. So I can see one more here. In regard to vaccination, we know there are general vaccine deficits with minority groups like Roma. So for COVID-19, once available, how do we make sure that minorities get equitable access? And also, how do we build trust with minority groups so they will also ask to receive a potential SARS-CoV-2 vaccine?
Yeah, well, that's a great question. On the vaccines, actually, we are not so far ahead to really see how we can do it, but definitely it's something that where we might see some discrimination or disproportionate application of the vaccine. Since we don't have the vaccine, there are no protocols of where do we start and how do we start. So it's a little bit difficult now to talk ahead, but then how do we ensure? What we are doing as NGOs is basically advocate and send guidelines and send recommendations to the Commission and to the governments of how not to discriminate and to leave behind vulnerable communities, in particular Roma communities. So when the time comes, definitely what we need to do is to approach governments and the European Commission to make sure that those protocols are not going to discriminate, nor de jure, nor de facto in the application of it. As it's a bit early to say, I can't be more specific than that. Maybe my colleagues with some medical background can be more specific.
Thank you so much.
I think just one point to add is the inclusion of people in the discussions. We had a similar issue around measles vaccination in London, and when I was working in West London, I conducted some focus groups with traveller communities there to try to understand what are the issues preventing them from getting measles vaccine. So I think including some of these, and we can start doing some of those actions now in preparation for when the vaccine comes out, to try and make sure we get as high coverage as possible.
Thank you so much. I can see one more. One of our participants would like to know how discrimination can affect its victims, and if you have witnessed any particular side effect of discrimination during your work.
Our work is dealing with effects of discrimination and ensuring that we combat it. And I was mentioning some examples of how discrimination is persisting during this crisis, or being made more pronounced when people are being denied medical care, where people are actively by, let's say, individual health professionals. We've also seen in many examples when they are being denied medical care as in a general sort of decision that nobody will bother about these people. And I'm especially talking about people living in institutions, residential care institutions. We have many cases in Poland, in Romania, in Italy, in many other countries, where basically they are left out to, well, either survive or die without any kind of pretense of medical care. So that would be some of the discrimination that we are witnessing right now around Europe.
Thank you so much.
Yeah, I could also give a specific example. I don't know if anyone from there is from Romania, but in north of Romania, there is a locality called Cluj-Napoca. It has been in around the locality. Roma people from the city have been a few years ago, or many years ago already, 10 years ago, they have been displaced on a garbage dump. Where there is a lot of hazardous, where you have also all the medical supplies, where the medical garbage has been placed there. So it's quite a bump to live there. You cannot breathe. People have developed a lot of diseases, and they have now with the virus a lot of preconditions. With the virus, they cannot really observe very well the hygiene and sanitary conditions. So therefore, they are more at risk to being contaminated and then also perpetuating or giving the virus to everybody else, since this community is quite compact. It has been an issue on the agenda of the EU for the last 10 years. But the garbage dump still exists there, and the community is still living there under inadequate housing conditions and with very little access to healthcare, health insurance, and work possibilities, and so on and so forth. So discrimination, a long-term discrimination, has really a huge impact on these communities with the coronavirus. So such examples exist, unfortunately, throughout Europe.
Thank you so much. So I think that we are coming to an end. So it's time for our amazing guests to share their final words if they wish to.
Shall I start? Just to say thank you very much to the organisers and to everyone participating. It's great to be having these kinds of discussions to talk specifically about discrimination and the importance of discrimination in COVID-19 health more generally. And this outbreak, if it can prove useful in some way, it's a wake-up call to all of us to think about how to structure our health system, to think about the next outbreak that will happen at some point. And maybe we can improve structures. My plea to all of you as medical students is to think about your clinical role, but also your public health role, and think about how discrimination can affect the health of your patients and population, and the social determinants of health, ways to improve justice. Thank you.
Thank you so much for your contribution. Mrs. Michalaki?
For doing this, I think it's so important to have these discussions with the youth and with students in medicine, and it's important because really starting so early to talk and understand discrimination could actually break the chain of discrimination that some of the most vulnerable communities are facing when it comes to their access to healthcare. The pandemic, unfortunately, is just a place and it's a time when we realize that we have more serious problems in our healthcare system. There's been pre-existing conditions and situations of discriminations that are becoming more visible now because of the pandemic. Now we can see that there's so many vulnerable communities that don't have access to water, don't have an infrastructure, don't have adequate housing, don't have a health insurance, don't have IDs, and so on and so forth. All of these are obstacles to an adequate health care. So by knowing that, by being involved already, maybe we can then contribute to changing the situation and the system by speaking out, by getting engaged with civil society a bit more, with students' organizations, and with everybody out there that maybe knows a little bit more about these communities. So I thank you very much. I'm very humbled by this possibility to speak to students, and hopefully we can repeat this at another time in better conditions. I wish you all the best and a good health. Stay safe.
Thank you so much. Mr. Zverepa?
Yeah, I would, of course, second everything that was said by my predecessors here. So thank you very much for organizing this discussion. I think it is very important and very encouraging to see that medical students take interest in discrimination of people with intellectual disabilities, among other people. And so thank you very much. If there is anything else, any more information you would like to know about people with intellectual disabilities and how they are affected by this situation, and not only this situation, you can always visit Inclusion Europe's website or follow us on social media when we share all kinds of content about what is currently going on in different countries in Europe. Thank you very much, and yeah, be in touch if there is any kind of more information you will be interested to have about this.
We're really grateful and lucky to have you all here, and this webinar could not happen without your contribution. So thank you so much that you happily accepted our invitation and you were here today. So for our participants, thank you for your interest and for being here for this webinar. Since the first step, awareness has been taken, you are more than welcome to be active on a local level in your NGOs and everyday life in order to tackle this problem all together, since the youth has the power to do this. Thank you once again, and we're here to share your feedback, your ideas, and discuss things. So have an amazing continue the day, and see you another time.